The NHS clearly has a role in promoting healthy and sustainable communities, and just one of the ways in which they can do this is through better building design and improving the energy efficiency of existing NHS buildings. It's estimated that better NHS building design could not only cut energy costs by a quarter, but improve patient recovery and increase the productivity of the 1.3 million people working in the NHS. Indeed, workforce productivity gains of between 6 and 16% have been identified in buildings with an energy-efficient design. Improvements in the quality of work and a reduction in absenteeism have also been reported. In this programme, we hear the views of Dr. David Pension, Director of the NHS Sustainable Unit, who tells us how NHS organisations can work towards creating a healthier, more sustainable future for the communities it serves. We also hear from HLM Architects, Interserve, PM Group and Devro Architects, who explain how they've helped the NHS promote sustainability and to make NHS buildings better places to work and treat patients.
The NHS Sustainable Development Unit is a research and policy unit for the NHS in England to help the NHS prepare for a low carbon future. Now that sounds like a very long way off, but in fact there are many very good reasons why the NHS would want to do that now. Preparing for the future is going to be good for preparing for the present as well. And that's one of the many fortunate things about the health service, or about delivering healthcare, is that many of the things you would do to prepare for a resilient, future-proofed service actually benefits the health service now.
HLM Architects is a national practice with offices all over the UK. We're a firm of architects, landscape architects, interior designers, and we have an environmental consultancy as well, and we work across the country. Healthcare is a passion of ours, and just like any building type, the way we design a hospital really makes a difference to how we shape the environment and also to the well-being of people when they're in hospital. These environments really are all about the communities they serve as well. So a hospital, for instance, is a place where the community can come. The design work that we do is really a complete function of how close we get to our clients, and particularly working with the staff to get the space just right, whether it's the interior space, whether it's the servicing of the space, because it's just as important for people working in the space as it is for the patients. And those two forces, when they come together, are very powerful in terms of well-being. One of the most powerful tools we have is to be able to spend the right amount of time, as much as we need to, with the clinical staff and the clinical team to make sure we get the relationships just right. And with so many technological changes and advances in medicine, this has never been more important. A great example of this is the Hull Oncology building, where really that is probably one of the best buildings that we've done in recent years and got the RIBA award in November. And that's as much a testament to the client and the users as it is to any architectural or construction input. In fact, we also got the Best Client Award for that, which was really great for our client. When you're designing a hospital for the treatment of cancer, like any other speciality building, the response to the inside and outside spaces is really important. The focus on how you get outside the building into courtyard spaces where you can spend your leisure time, and also the entrance area itself and how that feels, makes all the difference to what I mentioned about patients and visitors, staff and clinicians. When you enter the space, you're hit with daylight and sunlight and activity. And one of the first things you see is a welcoming space for natural and alternative therapies. So you can actually learn about those. There's also a research centre there, so you can learn about your particular illness or whatever, and see some of the research that's actually going on. This kind of soft entrance space is really important because it's the first impression anyone gets when they actually come into a hospital. Our modern healthcare environments, many of them are procured under the PFI initiative. I suppose the good thing about it is that you look at the whole life cost of the building from day one, and that's very important when you think of the cost of running a major highly serviced building like a hospital. But none of that should actually detract from the importance to the patient. The great thing about Castle Hill is that we were able to harness natural daylight and sunlight, the slope of the site, to create a series of really nice courtyards within the building. All the 800 rooms look out to a view, look out over the courtyards, so you're constantly in touch with nature. either working there or if you're a patient. It's this point I made about the importance of the different publics that come to a hospital. Yes, the patients, but also the visitors. The glazed links that link through the hospital. So you go into light and shade as you walk through. And the artwork that we use really makes a difference to people who are very concerned sometimes when they come to visit a loved one or a relative, but also for the staff, because working there all day, the importance of being able to get some views out, to go out onto an open space, to have all the catering facilities just right, and to make a happy, light place to be is very important for patient care. I think the challenge for us as architects and designers is how good are we at getting close to our clients in any building type. In a major hospital, we have a wide range of client groups, different specialities. We need to really work hard at listening very carefully to the real hands-on experience of our doctors and nurses, our clinical leads, our departmental heads, as we respond through the schedule of requirements to start to actually flesh out a response to a new design. It's that fourth dimension of input that's so important. As architects, we are supposed to be really quite good at explaining ourselves in 3 dimensions, but we're not always, because sometimes we get into situations where we think people have understood what we're trying to do and we haven't explained it quite carefully. So I would say to all our colleagues in the NHS, all our clients in the NHS, please, we know you're very busy, but what you give us in terms of your response is really important, and make sure that we know if there's something that we've got wrong or you don't understand. After all, the building that we're designing is your building, you're the experts, we need to respond to it. Your input is absolutely vital in all this. I hope you've seen some things which really inspire you to engage with those people, those external consultancies working with you. And I hope you realise how much difference you can make by your input to the quality of internal environment that's actually created. After all, this is your workplace, but the mission is at a much higher level for the people under your care, and everything you can do to help us to make the internal spaces, the circulation, the access to care and treatment, a welcoming place for visitors, all those things, everything through all your experience you can pass on to us will make a good building great, and that's the difference you can make.
One of the great advantages of the NHS being so big is you'll always find someone doing something right. And the onus that therefore gives us is that when you find someone doing something really great and really effective and really cost effective that public love, patients love, it's good value for money, the first thing you want to do is to say, why isn't everybody doing this? So a big role of the unit, well, not just our unit, but many of organisations like ours working in health and sustainability, is to identify and share good practice. Now, that's much easier to say than it is to do. For a number of reasons. Most people who are implementing really good practice are the real innovators, and believe me, there are lots of great innovators in the NHS. Most of those people are so busy doing it, they haven't really got time or inclination to go and shout it from the rooftops. So it's our job to go and sort of distill it, bottle it, and put it in front of everybody else. And now even then, it's not that easy, because that sort of procedure of codifying and disseminating and stimulating the implementation of good practice is remarkably difficult. And we're not quite sure why that's a behavioural thing, really. It's probably something to do with not invented here. That would never work here. And I think also when you're trying to spread good practice, there's a sort of implicit criticism that why aren't you doing this already? So it's a very, very tricky issue. However, we have been somewhat successful in that with our partner organisations, we've managed to get a reasonably good database of some of the most excellent examples in the country, and they're quite useful, not because people say, I want to do these things, show me someone who's done them. It's quite useful for us, for people to say, oh, it would be impossible to do this, and I say, well, they've done it there, so maybe not be impossible, maybe it'd be difficult, but it's not impossible because other people have done it. And I think quite often people do need inspiring stories to show that things are possible. But actually what's more important than inspiring stories is the nitty-gritty of actually how did you make that happen? How did you get around this piece of European legislation? Or where did you get some pump priming to to fund the transition costs. So quite often, so-called healthcare leaders have some great ideas, but it's left to others to say, how are we going to put this into operation if this is what we really need to do? And as you know, the health service is so incredibly pressurized by delivering the day job that delivering it in an innovative way that's fit for the future is yet another sort of responsibility, another sort of perceived burden. But we are getting there. But it is remarkably difficult. But it's great to have some really good case studies. It's great to be working with some partners both within the NHS and the sort of voluntary sector who are really committed to identifying these areas of good practice and making sure that we're all knowledgeable about them, so that we can remove all these barriers and give all these opportunities to such a remarkable bunch of staff in the health service who want to implement them.
PM Group is an international provider of architecture, engineering and project management services. We employ 1,800 people around the world. We operate here in the UK, in Ireland, across Europe, West and East, right through into the Middle East and in Asia as far as Singapore. Our main areas of activities are the life sciences, and that includes healthcare, medical research, biopharmaceuticals, food and nutrition, and we do a lot of work with university research centres. Devereux Architects is an integral part of the PM Group. They've been working with the NHS for the past 60 years since its inception, and in that time they've delivered over 500 successful projects for the NHS. The way we PM Group support the NHS and healthcare projects is successful delivery. That's the key of project management. The first thing we do is we build the budget. In fact, building the budget is the most important thing you do before you try to build the project. After that, we got to make sure all of the players involved in a complex healthcare project know their roles and their responsibilities. This is critical for collaboration and coordination. The next thing we have to do is to fight the enemy of a successful project, and that's change, uncontrolled change. We as project managers have to ensure that change is properly controlled. Otherwise you get what's known as cost creep. The other very important role we have is ensuring timely decision making. That poor decision making and delayed decision making is again one of the enemies of a successful project. And that's where we come in, to drive that decision making in a timely manner.
Devereux Architects are one of the top practices in the UK that specialises in healthcare, both in the UK and internationally. The key drivers for building a sustainable NHS are creating and providing facilities which are very specific to the use, which are highly flexible for changing healthcare, especially delivery of healthcare, workload and the technology that's coming forward. The NHS needs to consider all the environmental constraints that we're working within today. That includes low energy and use of resources. Any healthcare building we design for the 21st century has to be functional. The functionality is absolutely key. It has to create the right environment for patient care. Most of the work today is evidence-based design. This brings in this sort of clear thinking about patient safety, patient recovery, reducing length of stay, and everything else to do with the patient care and how we can actually improve the patient experience. And good design can result in good health. So if we get the facilities right, the patients recover and have a better experience and come out of hospital quickly. I do believe that foundation trusts, health providers are going to face significant challenges over the next few years. I think there's going to be limited capital for investment. That is going to be an issue. I think the level of tariffs will drive greater productivity. And I think especially as us as designers looking to help them to use their very expensive building assets efficiently and effectively is going to be key.
We as project managers support a healthcare project by first of all establishing the budget. In fact, it's often said that the single most important thing you can do on a project is build the budget right, then you'll build the project right. So we're there to give cost certainty, number one. The second thing we're there to do is define the roles and the responsibilities of all the various players that are involved in a very complex healthcare project. Then what we've got to do is ensure change is managed properly. Uncontrolled change is the biggest enemy of a successful project. We have to manage that change. The next thing we have to do is ensure timely decision making. Delayed decision making simply increases the schedule, increases the cost. And at the end of the day, we as project managers have to ensure that healthcare projects provide value for money. And that is another aspect of sustainability. We in PM Group and Devereux Architects are not just project managing and designing a building. Our mission is to deliver a facility that treats illness, saves lives, helps patients and users recover, looks after the welfare of healthcare workers, and delivers value for money. Now, when you add all that up, that's real sustainability.
We know that fossil fuels are going to be restricted in future because they're going to become less available. The price will therefore rocket, and we know that. So we see examples of that. The good thing about that is it stimulates us to be more innovative in where we get our sources of energy. Now, none of these are going to be free, but they may well be much more renewable energy. Now, renewable energy still costs because we have to convert it from sun or wind or wave power that we're quite moderately well blessed with in this country, which is we're very lucky in that sense. So we have to get very good at using our bargaining power. So the NHS spends millions of pounds on energy. So in terms of being a public sector exemplar, we should be using our buying power within the National Health Service to stimulate the renewable energy business in this country. That's quite challenging, actually. It's not quite as simple as it sounds, because the NHS is largely a set of quasi-independent organisations, 300 or 400 of them, and we seldom use our buying power as much as we possibly could. So there's great potential for doing that. So that's one issue. The other issue, which ties in with that, is that the NHS, or how the NHS behaves as an organisation, sends out very powerful signs to the public. So when, for instance, many years ago, when it was first established that tobacco was harmful, smoking was bad for your health, it was when doctors stopped smoking, the public in general started thinking, oh, maybe smoking is bad for your health. Maybe these doctors know something we don't. So it's important for people like doctors and organisations like the NHS to set not only an example, but a visible example. So when the NHS starts visibly using renewable energy as a business case, because it's cheaper to do it, it's better to do it, then that not only has the immediate benefit of contributing to the UK's renewable energy business, but the public say, oh, maybe we should be doing that. If it's good enough for the NHS, it's good enough for me. So there are multiple ways in which the NHS can promote this sort of sustainable future.
Interserve is a large FTSE 250 support services company. We provide our clients with asset and facility related services in the private and public sectors. We work from business case, design, construction and management of facilities through to the assessment of carbon performance. Interserve uniquely offers our clients some joined up services, and our depth and breadth of expertise across the building's life cycle enables Interserve to provide market leading solutions. This approach enables our clients to maximise the effectiveness of their organisational resources and meet the challenging environments we all face in this new decade. Within healthcare, Interserve has established itself as a key player. With 2,000 dedicated healthcare staff, we work to provide optimal facility solutions for our partner trusts. We work closely with these healthcare partners to set new quality standards in the patient environment, and we constantly strive to develop and shape our services to make them better suited to staff and patient needs. Sustainability is key in the planning and operation of modern and efficient healthcare facilities. Sustainability is obviously driven by that which is around us. There's a huge government drive in terms of moving sustainability policy forward and delivering on sustainability goals. The underpinning policy is around a better quality of life and securing the future, and what that's about is ensuring we provide for the needs of today without compromising the needs of the future. The NHS is the biggest employer in the UK. The NHS is by far the largest carbon producer within the public sector. It produces 25% of all carbon. To meet the targets, it's got to reduce its carbon emissions year on year by 3%. So the NHS must take the lead. We now have some tools to assist us in improving the carbon reduction. One of those is the BREEAM energy targets, and that's the Building Research Establishment Standards Toolkit for healthcare now, and that helps and gives us a solid platform to measure and monitor ongoing energy consumption and energy usage. We've got a team of dedicated carbon and energy specialists, and we've got a team of dedicated healthcare specialists. Putting those two together creates a unit which can really help a healthcare organisation plan its way forward in terms of meeting its sustainability targets. 3% year on year till 2050. Interserve provides a range of services across the built environment. We design, we build, we operate facilities. We also finance those and provide infrastructure support. At UCLH in London, we're providing FM services there. At Christie's Hospital in Manchester, we're providing construction and design services. Freeman Hospital in Newcastle, we're providing FM services. Currently, we have 50 projects underway with the NHS throughout the UK, England, Scotland and Wales. The future is about joining those services up. It's using the skills that we have within the whole asset life cycle, and that will then provide the NHS with a partner who can really help them deliver on their efficient and effective healthcare facilities. Interserve is working with a number of trusts on sustainability. It's on everybody's agenda at the moment. But let me give you some examples. At Malvern, we're providing a new community hospital there, and it's a very exciting design which we've integrated sustainable solutions into the very essence of that design solution. We've got a combined heat and power unit which uses waste heat to power the heating and ventilation systems. We've got ground source heat pumps on that facility, and we've got photovoltaic cells that are built into the roof structure. All that giving a very high quality, patient-focused building, but one which has very solid green credentials. We've worked with them to look at their waste management, at their transport policies, water usage. All of these things go together now to create a sustainable building for the future. Interserve supports high quality care in the sector. Through joined up services, we're making a real difference to the environment in which patients and staff are now working within the NHS. We have a dedicated team. We have 2,000 people whose day-to-day work with the NHS. We're a learning organisation. We can work with you on individual schemes and individual projects. Interserve is ready and willing to provide these joined up services, working in partnership with trust organisations to meet the challenging financial conditions that lie ahead for us in this next decade.
We hope this programme has gone some way in showcasing what the NHS can do to promote sustainability and to make NHS buildings better places to work and treat patients. By learning from good practice across the health and public sectors, all NHS organisations can work towards creating a healthier, more sustainable future for the communities it serves. I'm Georgina Burnett, and you've been watching Building a Sustainable NHS. Good build, good healthcare.